Spending other people's money, of course it's a good buy.
Mr. Stark, I'd like to start by thanking you for coming today. Obviously, there's a lot of emotion in the room. I have a little bit of emotion myself, and then I'm going to try to clarify one point you made. I need a degree in audio to talk here. First thing I'd like to say is I'm a little bit sad with how these town hall meetings, anybody who opposes this healthcare, has been characterized as either a mobster or a barbarian or un-American.
Yeah.
It troubles me somewhat that people who are engaging in the most basic rights within democracy would be labeled as such, certainly enemies to the state. Having a snitch site on the White House website is also troubling.
You spoke.
I'm sorry?
Keep going.
You spoke briefly about tort reform and it saving countries, states less than 2%. I can tell you.
Saving the system.
I know for a fact an orthopedic surgeon's malpractice insurance in New York State is about $90,000 a year. In California, where there's tort reform, it's about $20,000 a year. That is an absolute fact, and that's a lot more than 2%.
That's right.
I have a patient, in the interest of full disclosure, I'm a physician. I have a patient who is a patient of a colleague of mine who wrote a letter to her Congressman Eshoo. Now this is an elderly woman who's an amazing woman. Among other things, she's a helicopter pilot. She writes, weary of the claims and counterclaims regarding H.R. 3200, America's Affordable Choices Act of 1990, I am reading it for myself. You need to read every word of this document before voting on it. Not only is that your job, but when you do, you will discover that this bill will put our entire healthcare system under strict federal government control. Something that is anathema to most Americans, including myself.
Yeah.
You have no right to force us to purchase government-approved insurance, yet this bill would do just that. President Obama's claim that we could keep our own insurance if we wanted to is simply not supported by the actual text of H.R. 3200.
Right.
Please read pages 16 to 20. You will discover that yes, at first existing plans will be in fact grandfathered in.
Yes.
But starting in 2013, which is designated as year one, then one's plan becomes disqualified if any of the following changes happen. A carrier adds even a single new subscriber to their plan. One carrier's changed anything in their plan even for the better. Or we reach the beginning of 2018. As soon as any one of these happens, that plan loses its grandfather status and will switch to a plan that meets the federal government specifications.
Thank you.
I understand that Nancy Pelosi has given talking points for a lot of these town hall meetings, and I think polling shows that we, as citizens, generally don't like insurance companies. My simple question to you is this: rather than trying to sneak everything under a single healthcare reform bill, if your problem is with insurance companies, why not you submit legislation specifically saying that from this point forward, insurance companies will not be allowed to exclude coverage based on pre-existing conditions.
Thank you, Doctor. That is in the bill, that insurance companies won't be able to exclude pre-existing conditions. I'm happy to say that the AMA, the CMA, California Medical Association, the American Medical Association have endorsed the bill. There may be some physicians who don't like it. If the bill doesn't pass, physicians are facing something like a 20% cut in their fees. So it may be that they're trying to postpone that, and that's why they endorse it, rather than the quality of the bill. We have consulted with probably every specialty group in the country. They've attended, we've had 79 hearings at which every specialty group has had an opportunity to testify. And I think most of them support the tenets of the bill. Can't please everybody, and well, although we'll try. And
are you going to answer his question?
I have somehow my ears keep hearing some. A nuisance here in the front door. But we have number 163, number 8.
Answer the question.
I need to hear from number 8, number 2, number 163, and number 102.
Boy.
Do you want me to repeat the question?